What's the best laser for skin resurfacing in 2016 to tighten skin, improve texture, pores, and wrinkles? Specific concerns are the eye and nose area. Also, do they promote rosacea like broken veins?
Thank you for your question. You've submitted a question without a photo, and you're asking what is the best laser for in 2016 to do resurfacing, to improve skin texture and pores and tighten skin. You've also stated that you're interested particularly in the eyes and nose area. And lastly, you are concerned about the possibility of lasers causing blood vessels to form or the onset of rosacea. So certainly I can give you my opinion about this question and how I approach that question when people ask me the exact same thing in my practice. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island over 20 years. I began my career with the first CO2 lasers for ablation back in the early to mid-90s and have many lasers in my office. And I can tell you a little bit about how I make this decision and give you some guidance on how you should also consider and what you should consider when you're thinking about laser treatment. So to begin with, the very question you're asking results in almost a knee-jerk reflexive reaction by physicians who are all thinking with the best interest of a patient in mind, but usually it's also because they own a particular laser or they're leasing a particular laser. And although there are many choices on what can be used for resurfacing, improving skin quality, and improving pores. But the first question is really about proper diagnosis. You see, there's been this natural evolution of improvement in the types of lasers and the modalities in which we're able to apply these lasers. There's also been radiofrequency technology brought in. But when you get down to all of this, you have to still understand what your desired outcome is. You have to think, will laser be the right solution instead of saying which is the best laser? For example, we have also learned a lot about the potential of what we want to do with a laser being accomplished with alternatives. For example, when you talk about tightening skin, improving texture, improving the appearance of the skin, you're talking about increasing collagen, improving the quality of the skin and the blood supply, and the skin looking smoother. Well, I found that what I used to do with the more aggressive ablative laser, like a fully ablative CO2 laser, I do differently now, but not with laser alone. I'll do a combination. I'll use something like platelet-rich plasma and place it under the skin. And platelet-rich plasma, in case you're not familiar, is a concentration of your body's, from your blood, of wound healing factors that stimulate repair when you get a cut. So your body knows how to restore collagen blood supply as a response to injury. So with platelet-rich plasma, what we're doing is we're concentrating those same growth factors from your blood. So instead of using heat to try to stimulate a healing response, we're actually using your body's own growth factors to stimulate a comparable response. Now, where does lasers fit in there? Well, when you do something like platelet-rich plasma, you can actually be more conservative with a type of, let's say, resurfacing laser. So instead of fully ablative, we'll do fractional. Depending on skin type, we use fractional erbium or fractional CO2. I try not to always talk about the brand name of a laser, but rather about the category of that laser. We have several lasers in our practice, and all of these lasers are actually very adjustable. We also have non-ablative technology, what's called ND-YAG technology. And that type of laser, you actually improve texture of skin quality by going through the skin into the deeper layers of skin to stimulate new collagen formation. So I think that it's very important that you get an understanding of what your options are by proper evaluation. Literally every week, I get to see people who will tell me that they got the, quote, best laser last year, of last year, but they didn't get the results that they wanted. And often people are going from one laser in one doctor's office to a laser in a medi-spa, and versus going on to another place and basically bouncing from one laser to another because they keep watching television and seeing the promotions of different name brand lasers. But what really is critical is the physician who communicates with you about your skin condition. A lot of times it's better to prepare the skin before doing a laser. So I think my point is don't hang your hat on a single laser as the best laser of this particular year. It's really about the doctor who makes the diagnosis, makes the recommendation, and then performs the laser and then treats you after the laser. You know, this is really a tool. It's a very exciting and very capable tool, but it's part of a spectrum of many different technologies that are now available. So I would say that you can certainly get lots of ideas of what's out there, but really there's going to be there really is an art to helping people improve their skin, and it takes a lot more variables factored in before you decide what's the best laser. That's why a busy practice like ours, we have multiple lasers, and all those lasers have different applications in different scenarios. So meet with doctors, figure out what your particular skin issues are, understand what the treatment plan would be and what you can expect. And I think that you have to just understand that it's not about one particular best laser. Because frankly, if there was just one particular best laser, everyone would own exactly the same laser. But rather, it really is about what is the best approach that's right for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.